you'll lead off. Some of the arguments for and against question 4 deal with tax and spending practices. That is, what state and local governments have or haven't done as stewards of Maine's public resources. In defense of your position, please explain what you believe state and or local officials have done or failed to do in terms of controlling tax and spending practices.
Thank you very much. Well, I am serving my first term, so there is a steep learning curve when you come into the legislature, so I'm catching up on a lot of information. But in 2005, Maine passed LD1, which was a spending limits cap to address the concerns of the rising amounts of spending and state government or alleged spending and the rising increase of property taxes, which are, quite honestly, the number one concern people have when they're talking about their taxes. Since LD1 has passed, we have lived within those limitations. We have reduced spending, and I think that that is a good step in the right direction. We also passed a tax reform bill this year, which would have reduced the overall tax burden on the people of Maine. And, you know, through that vibrant people's veto process, opponents of that went out and got signatures and are working to try to repeal that. An open government process is an example. I happen to disagree with that, but the process is there, and people can gather those signatures and do that. I talked with one of the towns in my district, which is Bangor, Vesey, and Orono, to find out, you know, what exactly are they doing? What kinds of decisions are they making and to address these issues? And the city of Bangor, for example, has remained within the LD1 limits in the budgets that it submits. It, in fact, is $450,000 less than the LD1 limit allows them to spend. They have been working on regionalization. They have been streamlining processes, putting more services and processes online to require less human bodies and long lines for people to obtain and apply for services. They have been working with regional communities on how to streamline emergency management services, for example. So in reality, local communities and the state legislature are doing their job. Not everyone is going to agree on every single solution that every town or legislator is doing. But we elect our leaders to go do this job, to study the issues and make informed decisions. And that's what I've tried to do as a state legislator, is to the best of my ability, learn all aspects of the issue, and then make the best informed decision for what I believe is in the best interest of the people of Maine.
Thank you very much. Senator Westman.
Thank you. The first committee I ever served on was education. And one of the things that I was very pleased to work on was called Essential Programs and Services. And it was a plan to bring equity to education so that every child, no matter where they lived in Maine, would have an excellent education. Imagine my surprise when, in some late night meetings on LD1, before the legislature was even in session, this bill was being worked on mostly at nighttime. Imagine my surprise to see that LD1, the centerpiece, was Essential Programs and Services. And instead of being an equity piece about making sure everyone had a quality education, it had become a cost containment plan that had lots of loopholes. For example, none of the increased spending was going to count towards the LD1 limits for the state. And since then, we have used that to push more costs out onto our towns. So what have our towns done about this? In South Montville, we have this wonderful little townhouse that has a long stovepipe going from one end of the room all the way to the stove in the center, and we sit there every March and make decisions. But it is hard to make informed decisions. Even the question on LD1 is battered about in a very loose fashion. Now, I've worked closely with my selectmen for all these years, love them dearly. They have actually taught me a lot. But there is also a culture. Maine Municipal Association is their umbrella. And so even the individual selectman may want to be fiscally conservative, want to hold down spending. But when he gets mandates from the state of Maine, and when he has to match this particular grant, then LD1 isn't as significant or meaningful as it should be or as understandable.
Thank you. Good thing, John.
Well, I like the focus on local spending because I think that's the most obvious area where Maine has been extraordinarily frugal, as noted in a paper published by the Maine Heritage Policy Center last November. And so it just isn't the case that municipal spending has been growing out of sight. It is lower on a per capita basis than most parts of the country. We have a more difficult time when it comes to state spending. And there are two areas in which state spending has grown, and one is education and one is healthcare. Let's take them separately. Let's start with education. The decisions about budgets are on education done in those town meeting settings and in local district budgets. So everyone in this room, if you're a voter, has had the opportunity to vote on school budgets. So if we're unhappy about the property taxes, most of which are driven by decisions in the school side of the budget because of the frugality of the municipal side, then we have only ourselves to look at why have we gone and approved those school budgets if we're unhappy about the pace of school spending. I agree that over time we need to slow that pace because we're not going to be able to continue to afford the regular annual increases that have been the case. But it's not so much, frankly, a case of the state pushing requirements onto local school districts as it is the case of local school districts and people, local voters, pushing a rate of increase that the state has been running to catch up with. And that's why the legislature decided in LD1 to exempt new spending on schools by the state because there had just been a referendum. The people of Maine have said they wanted to go to 55% contribution. So it made no sense when the people had just mandated increased spending to then to put a limit that would not have permitted the state to try to reach 55%. Now, the state has been unable to reach 55%. But nonetheless, there has been an effort, and it's now at about 50%. So that's on the education side. On the healthcare side, we have a real dilemma in this state in providing a lot of healthcare to a lot of people. The good side of that is that we have a lower rate of uninsurance than almost every other state. We're in the top 5 states in the country in low rate of uninsurance. But that's costly. We have to look to all of our local hospitals as to why it's so costly.
Thank you, Kit. Steve Bowen.
Yep, a couple of things. I'm glad to hear that Kit's a fan of folks going out and voting on their school budgets. You didn't have a chance to do that a few years ago, and now you do because they taborized that section of the school budget. The original question was, what have we not done, or what have policymakers not done? I'm going to tell a story from when I first went into the legislature. We're going to talk about a spending problem. Back when spending has flattened out. But why? Because they've suddenly realized that they can't continue the spending now. They don't have the money. That's why it's leveled out. Between 1995 and 2001, the general fund budget went from $1.6 billion to $2.6 billion. $1 billion increase in 6 years. Adjusted for inflation, that's $400 million in 6 years. That's what they do when they have the money. But when I got to the legislature, I came in with Governor Baldacci in 2003, we had a $1 billion shortfall we had to deal with. So I said, well, this is going to be great. We're really going to have a good discussion. We're going to have a good discussion as a state about what kind of state we need this to be, how we can't sustain all this spending. That's become obvious. We're going to have to really look carefully at what we're doing. We're going to have to look at putting 23% of the population on Medicaid, which is why we have the low uninsurance rate, because everybody in the state, or a quarter of the population of the state's on Medicaid, the highest rate in the country. And we're going to have these discussions. But you know what? We didn't have those discussions. To close those budgets, both in my first term and when I was on the Appropriations Committee, we never had those discussions about how big should the state government be. We did a lot of one-time funds. We cleaned out reserve funds. We refinanced debt. We got rid of vacant positions where there hadn't been somebody in those positions since the McKernan administration. We eliminated these positions. We carried on the books for years. We did all kinds of one-time things to muddle our way through. But we never had this discussion about what is the proper level of state spending. And that's what still hasn't happened, even now. And now we're not even trying anymore. We're passing a state budget, a balanced budget, that had a line in it that says, oh, we'll find $30 million later. That's the balanced budget that we passed back early in the spring. It's balanced except for $30 million. Well, they've had how many Appropriations Committee meetings now? They've found like 400,000 of the $30 million so far. So we're not having this discussion about what's the proper role of government. We're going to hear that government should grow at the rate of increase of the state economy. Okay, that's what LD1 does. LD1 allows government to grow as fast as incomes grow. So your income goes up 10% and your tax bill goes up 10%. That's the path we're on right now. And yes, spending is down, but only because they don't have the money. When I was on appropriations, I remember the last night we were doing the budget. We were counting down. After everything we approved, we'd ask the fiscal staff, how much money's left? About $5 million. Okay, let's plug in this, and this. Now how much is left? About 2.5. All right, blah, blah, blah. And we got down to like $300,000. And then it was like, all right, we'll put 40,000 over here, we'll put 6,000 over there. Literally, we got down to the last penny. This is the middle of the night negotiating this budget. And guess what? If we'd had 20 or 30 or 50 or $100 million more, we would have spent it. Because that's what happens.
Actually, Steve, well, now our 30 minutes